So this video is to demonstrate how we can carry out a mandelic acid peel in conjunction with dermal needling. The rationale for doing this is we're using the mandelic acid purely to exfoliate the surface, and over a 10-minute period we'll thin the stratum corneum by about a third. The EnerPeel mandelic acid also incorporates MSM, so that will suppress epidermal erythema. The aim is that when we do the microneedling, we're needling into the dermal layer many thousands of times, and that means that we're causing direct dermal micro-injuries. If that's the case, we don't need the epidermal trauma. So that is something that SkinMed believes strongly and that clients prefer, so that they can go home and just be mildly pink and quite often are not even red the next day. So at the moment we're just removing the remnants of the anaesthetic cream. We want to make sure all of that is thoroughly removed and there's no stickiness left on the skin. The eyes are covered, the lips are protected, all areas are covered up apart from the areas we're going to treat. So the next stage is we're going to use an EnerPeel preparatory wipe, which will remove all of the, or any remnants of the cream. These preparatory wipes are 99% antibacterial, and so they're ideal preparation for the skin. They remove surface lipids so that the EnerPeel mandelic acid can interact with the skin rather than sitting on the surface and interacting with any lipid component that's sitting there. So that's that done. Now we're just going to check that there is no stickiness at all left on the skin, so you can just touch it if you feel any tackiness. So now we're going to apply the mandelic acid. So we're just going to get it flowing on the back of the hand. We apply it with a brush. It's a 2 ml solution of 40% mandelic acid, but in a carrier solution. The EnerPeel carrier means that the acid is protected and it's not actually live acid on contact. As it absorbs into the skin, and we get 300% more acid molecules crossing the stratum corneum than you do with the standard mandelic acid. That's the same for our other EnerPeels as well. Mandelic acid is antibacterial, antiviral, antifungal. But as a big alpha hydroxy acid molecule, it also doesn't trigger hardly any erythema and is the most popular peel used in the Indian subcontinent because it's so unlikely to trigger post-inflammatory hyperpigmentation. 20% or half of the 40% mandelic acid is in the mandelic acid form within the EnerPeel carrier. So that's the main bit that's going to do the surface exfoliation, although it is penetrating across the stratum corneum. The other half, the 20% of the 40%, is in the mandalate form, and we use that with the EnerPeel carrier to transport the mandalate deep into the skin, where when it reaches a level of moisture content, the carrier molecule is stripped away from the mandalate. The mandalate converts to mandelic acid and works much deeper and has therefore a stronger anti-aging impact. The other thing that it does, it helps with the constriction of partly damaged blood vessels. So it can also be a benefit to use with rosacea patients and people with maybe some broken veins. The peel's now on. It's been running 2 minutes now. The normal question, if you ask the client how do they feel on a scale out of 1 out of 10, as in 10 being very painful and 1 being hardly at all, I'm going to guess, what's the score please, Lucy?
1.
A 1. That's what you'd expect. If somebody was reacting within the first minute quite strongly, I would be concerned and would probably want to remove it on the basis that it might be sensitive to alpha hydroxy acids. So we're going to let this run now. You can see that there's minimal erythema, and that the fact that the mandelic acid also contains MSM. Methyl sulfonyl methane is a well-known anti-inflammatory and reduces the release of things like interleukin-1 alpha, so suppresses any erythema. If you put MSM in a normal 40% mandelic acid solution, the acid would destroy the MSM. But because the EnerPeel carrier isolates all the mandelic acid molecules, rendering them inactive in the solution, then you could put other treatment ingredients within the mandelic acid solution. We're going to pause the video now and come back at 10 minutes when we get to the neutralization stage, and then we'll move on to the needling. So we've now reached the 10-minute point, and we're going to neutralize with a 12% arginine solution. Arginine is an alkali amino acid. We use arginine rather than sodium bicarbonate because arginine can also be attached to the EnerPeel carrier. This means that wherever the peel has gone, wherever the acid has gone, in the skin and on the skin, the EnerPeel neutralizer, the arginine, can hunt it down, so we neutralise the acid not just on the skin but in the skin. This is the same when we do a TCA. So we do neutralise our TCAs, whereas many other companies say you don't. Now arginine is also good food for the skin, so any remaining arginine will be taken up by living keratinocytes, and in that way the keratinocytes use it for energy as a food, which creates the production of waste products. That waste products in the cytoplasm of the cell draws moisture in from the surrounding hyaluronic acid held water, and that plumps the skin up. So after an EnerPeel session, it's quite normal for the skin to feel plump and tighter for a good 4 hours afterwards. Well, that's the arginine effect. So we've neutralised the skin. Now we're just going to cleanse any remaining carrier from the arginine neutraliser that may be left on the skin. So we're using water. That's another difference with EnerPeel. With any EnerPeel, you can cleanse the skin with water afterwards. Because our EnerPeel carrier transports the acids into the skin, we don't leave crystals of acid to form on the skin, which with other peels, if you dampen the skin with water, can activate those crystals of acid. That's why they do it. It doesn't matter with EnerPeel. You can cleanse the skin with water afterwards. We're now going to move on to the needling session, and what's going to happen is we're going to smear a gel cream all over the skin, a thin film, to use as a glide medium. This is an MSM containing cream called Sensicure. It contains epidermal lipids and water binding agents, very good for allowing the pens to glide over the skin, but at the same time we're suppressing surface erythema. As before, we don't need the epidermal erythema if we're causing a direct dermal microinjury. So the stimulation of collagenesis, the activation of the enzyme matrix metalloprotease 1 in order to break down the old collagen that's causing any of the lines and wrinkles, that's all being done by needling into the dermal layer. We don't need the epidermal trauma. We may see some pinpoint bleeding, and again, that's not necessary, but what we want to try and be sure of, and that's what we're using it as a guide, to show that we're actually reaching the reticular dermis. So we now have some Sensicure on the skin. This is legal to use, we have checked. So using other things like HA or EGF, growth factors, etc. as a glide medium is not, because you've made a topical, you've applied it as a topical. You needle it into the bloodstream, then, and the patient has a reaction, then you could have some issues if they then complained. So we have the pen, the needle's in. If you want to see full needling, we have a separate DVD of this. So we're starting the needle off. We've got 9 33 gauge needles. We're going to check for sensitivity in the centre of the forehead just to see how the patient reacts, and then we're going to start moving in little microcircles. You can see we're getting a micro bleed there, so that's fine. So again, small circles is best. With this pen you can use it in small circles because that doesn't, the motors are strong enough, so any pressure from doing small circles is fine with this motor. It's guaranteed for 10,000 hours. So the 9 needles are going in and out at up to 120 times a second. Also, we pull the needles out, so our motor doesn't just push the needles in, it pulls them out. so you know the needles are clear of the skin before they're pushed back in again. Many other pens will use the spring as the only way of retracting the needles from the skin, and the spring cannot keep up with the motor that's pushing needles in at 120 times a second. So with some of the others, the needles don't clear the skin before they're pushed back in again. That can increase surface trauma, surface scratching. The whole idea of using the Derma FNS and using it with the mandelic acid is to minimise surface trauma, so the client can go about their daily life usually within 12 to 24 hours, whereas in other systems whereby they don't suppress the erythema and you get more surface trauma, the redness can be around for 3-4 days or more. Now we're making sure that we keep the head of the needle flat to the skin as we go around, so you don't get any edging when you come around to the temple area, and you're making sure that the client is comfortable. We go in 3 directions, so we go up and down, we go side to side, and then we go on a diagonal. Now that 3 ways harks back to old dermal roller training, but we find it's good that if you follow that sequence, then you know you're getting the right number of insertions in each area of the skin to get the most optimum collagen induction. Within a minute we're putting around 80,000 micro holes into the skin. This is a physical Fraxel, and the results are comparable to using a fractionated laser, but without the associated costs. This is a physical needling, so we're not introducing light energy, we're not introducing energy that can denature the proteins. Same as RF, radio frequency will denature the proteins. We found that there's no improvement if you add needling and RF together. Needling on its own gives the best results, and needling on its own doesn't create heat shock proteins and is much less likely to trigger any post-inflammatory event. Now we're going down the nose. We work our way down the centre of the face because the height we use for the forehead is usually suitable for the nose, and then we'll move into the upper lip area, which is a sensitive area. We like to do that quite early in the procedure, and then we'll go on to the chin and then work our way around into the cheek and jawline areas. You get the client to pull their lip down so that they show their best face to camera. And again, we're doing this quite superficially because this is a demonstration. If you watch the full needling training video, you'll see it's a bit more in depth. So we're working our way around to the chin, then we're going to work our way around to this side of the face, and we're going to change the needle height and move it up to maybe 1, and then up to 1.5 for the cheek area. You make sure you're engaging with the skin. You've definitely got a little depression as you're going across the skin. You're not hovering above it because that can lead to more scratching. You are engaged with the skin, and the needles are going in and out quickly. So you're going to change the height as you have done now, and carry on round the jawline. It's more at 1. So we're going to allow this procedure to carry on going as with the dermal kneading training video, and we'll come back at the end just to go through the final procedures in order to send the client home happy with healthy skin. So here we are back again. We've completed the needling procedure, and we're just taking lots of the Sensecure anti-erythema MSM with its associated epidermal lipids, which help to form a seal over the skin, protecting it from bacterial infection over the next hours, over the next few minutes while the holes all close up. And also it contains xylitol, which helps to maintain water, so it's important that transepidermal water loss rates are controlled, and we just massage that all in the lovely beauty therapy techniques, and the client will end up with just a healthy pink glow, but their dermis has been stimulated. As I say, we're using the mandelic acid to exfoliate. By thinning the stratum corneum by a third, you will find that you can also use a lower needle height to get the same results. But what we're doing is we're getting the epidermal finish and the dermal stimulation. You can watch the Mandelic peel on its own on another video, and you can watch the full dermal needling on another training video. I hope you found this useful.